Why do people, when I say people and I mean students, when they have a skill called bedpan and measuring output, automatically just go to wiping the patient's bottom or buttocks? Why is that? Why do we have that confusion? Well, today I'm going to be talking about that. I'm going to try and hopefully smoothing out a best way to do that skill. So today we're going to be learning how to do the bedpan and measuring output in a good way. Hello and welcome to Nurse Amy TV channel. It's Nurse Amy back on your screen. So one of the things I've decided to do, and this is coming from a lot of pressure from my students, is that I should do some Q&A. So this question I actually took from one of my students called Abby. Abby is someone I am putting through, let me explain that correctly, someone I'm helping through nursing school. And she had passed through my CNA class and now she's in nursing school. Yeah, Abby, I'm so proud of you. And but one of the things she had struggled with in class was how to do or perform the bedpan and measuring output correctly, properly. I do know that in one of my videos, well, if you're new to my channel, I have videos of skills that I'm doing, that I'm teaching in class. And as a CNA, you do need to know those videos, so they're all there. It's free for you. One thing I also want to end back on now, again, because again, from pressure from my students, is how to do these things. I should talk them through it, and that's fine. So I'm going to start the how-to series, if you will. So the first one is the bedpan. Now, I do remember that I've given a tip to do this properly, but again, I don't mind doing it again. When you're doing the bedpan and measuring output, you have to hand over the tissue paper, right? The toilet paper to them. That in itself should remind you, indicate to you that they can wipe themselves. So that means you should not be wiping them. I've had students in class do this, especially those who work out in the field. Because a lot of times, people that you will put on the bedpan, or people you will be handing a bedpan to, you might also need to help them wipe up. Well, this is not necessarily true for this skill. You're handing them the paper towel, not the paper towel, the tissue paper or the toilet paper, and you're walking away from the room. That is another one. That is another tip that should indicate to you that, oh, guess what? They don't need me to be there. They don't need me to watch over them. They don't need me to, what's the word? They're not totally dependent on me. So you do walk away from the room. And then you come back. When you come back, the first thing you should do is take that toilet paper from them. So I've also been asked, since they've wiped themselves, so where should okay, so follow me here. They wipe themselves, but something is still missing. How come they don't have, where did they throw their used tissue paper? Well, darlings, it's a test. They really did not use the bathroom, okay? So we need to be able to separate the outside world from the book world. Does that make sense? So they did not really use the bathroom. So you need to understand that, okay? With the bedpan and the output, the big thing is how you place the bedpan on their buttock. For standard bedpan, it's in a triangle form, like an upside triangle, okay? That is, so the wider part is towards the buttock, and then the angular part is towards the foot of the bed. If you're using a fracture pan, which you can use, you do have that option. You just make sure you know how to place it. It's the opposite way. Is actually the side is like the right side of the triangle. So the part with the handle faces towards the foot of the bed. You need to understand that. You're going to be asked questions like this even in your written exam. And if you do get a skill that has you performing bedpan and measuring output, then you have got to know how to place them. Okay, watch my videos. I will link them somewhere in this video, but go through my library is there. Bedpan and output. Okay, another thing you need to be aware of: when you leave the room, make sure you hand them the call light, because they need to be able to reach you to come back. Okay, so that's the thing you need to remember. You also need to remember, again, you have to have gloves on. We're talking body fluids, we're talking the genital area. You need to have gloves on. So I'm hoping that all this that I'm giving you is helping you, because I know students struggle through this. And even now that Abby is in nursing school, she tells me something she still struggles with because she did fundamental of nursing. And it's one of the things that came up. So I'm hoping that I've answered this question. You're handing the toilet paper to them, you're walking out of the room. That is one indication to tell you they can wipe themselves. So there is no wiping them. When you come back, take the toilet paper away and then, go on with the other parts of the skill. So if you still have or you need clarity about this, let me know and I will answer more questions. So that is a good way how to place a bedpan and measure output. Talking about output, it's very important that you don't spill the urine, because guess what? If you spill it, then they cannot give you credit. So even if you place the bedpan properly, perfectly, and there is no urine to measure, guess what? There's a problem now. They cannot give you credit. So hopefully this helped you. Okay, my next video I'm going to talk about measuring output. That is very important.